Since I was born, this is the first time I'm hearing that somebody died of ordinary malaria. Ordinary malaria, what are you doing?
Ole! I have risked sea breeze for some fly-by nights.
I'm in there.
Watch Newman Street at these times on NTA Entertainment.
Zaman lafiya da ci gaba.
Udo na ọganihu.
Bemanze hamu.
Zinzi lafiya kalakama.
Ẹ̀bọ lánà jẹ gọ̀bú.
Àlàáfíà pẹ̀lú ìlọsíwájú.
Emem yẹnka iso.
No matter the language, the verdict is the same.
Good afternoon and welcome to today's edition of Panorama from the Lagos Network Center. Our focus today is the World AIDS Day celebration with the theme Focus, Partner, Achieve an AIDS-Free Society and Generation. About 35 million people are living with HIV. An estimated 4 million have died of AIDS. This and more we shall be looking at today on Panorama from the Lagos Network Center. My name is Jennifer Igwe. Okay. A critical look at Nigeria's petroleum industry bill to ensure that the country remains competitive while assessing other markets will reposition Nigeria considering the current trend in the global oil market. Minister of Petroleum Resources, Dizani Alison Madueke, stated this on the sidelines of the 160 OPEC conference during which she was selected president. Energy correspondent Hawa Saliu Adama examines the current trend in the global oil market and the role of OPEC. Good afternoon.
Aside market fundamentals of demand and supply, the global oil market is to a large extent said to be driven by external factors such as speculations and geopolitical tensions in producing countries. In the last 3 months, the price of crude oil in the international market has continued to nosedive from about $100 per barrel to below $80, with what has been described as ample supplies, mainly from non-conventional sources like the shale oil from the United States, a major driving force. Although many producing countries are now losing revenues, with Russia said to have lost about $100 billion so far, the Organization of the Petroleum Exporting Countries, OPEC, which controls about 40% of world production, at its 166th meeting in Vienna, decided to maintain its 30 million barrels per day production quota, stressing that supply will balance demand in 2015 as it continues to monitor the trend in the interest of stability.
The OPEC and non-OPEC producing countries are in the game together. But of course, as an organization that has a long history in terms of the global crude market and prices, OPEC will do everything possible to ensure that it maintains stability in the market as far as we can.
While the issue of ensuring a balance in the global oil market was a major note at this meeting, OPEC as an organization also made a breakthrough in its leadership. Call it a breath of fresh air. So, for the entire 2015, Nigeria's Dezani Alison Madueke will steer the affairs of the OPEC conference.
If we remember, it was during the period of Dezani Alison Madueke that we have the Nigerian content under her ministry, which simply empowers Nigerians to come into the sector and to excel.
It has brought a lot of greater visibility for Nigeria in the world affairs.
OPEC has so far had 65 conference presidents and alternate presidents, with Nigeria featuring prominently and now producing the first female in its 54-year history. In Abuja, Hawa Salihu Adama, NTA News.
Following last Friday's bomb attack, which claimed many lives in Kano, Vice President Mohammed Namadi Sambo has, on behalf of the federal government and Nigerians, visited Kano with a delegation to condole the people of the state. State House correspondent Hamza Musa Makrafi reports.
Vice President Muhammad Namadi Sambo with Governor Rabi Musa Kwankwaso visited the palace of the Emir of Kano Muhammad Sanusi II, where he said President Jonathan is pained about the unfortunate incident. He urged Nigerians to sustain prayers against recurrence.
This evil will not continue in this country. The government and the people of Nigeria will cooperate and to ensure that this menace of Boko Haram will be a thing of the past.
The Emir of Kano appreciated the president for the condolences and urged government to intensify efforts at securing the nation against terror. The vice president visited the scene of the bomb attack and hospital to sympathize with those injured. Vice President also went to Kano State Government House to condole Governor Rabi Musa Kwankwaso, who said security operatives in the state are working in synergy to addressing security challenges. From Kano, I am Hamza Musa Magaripi, NTA News.
A coordinated bomb attack at the Maiduguri Monday market yesterday killed scores of people and injured many others. It's the second attack executed by a female suicide bomber in recent times in a week. Ahmed Alkali Alba reports.
Less than a week after a coordinated bomb explosion at Maiduguri Monday market which claimed scores of lives, two female suicide bombers carried out another attack at different locations of the market. According to eyewitness account, the two suicide bombers were discovered by vigilante operatives while attempting to get into the market. The first suicide bomber was said to have set off the explosive when the vigilante carrying out stop and search at the entrance stopped her from gaining access into the market.
To da ta shigo a guje suna ce mata su tsaya ta yi a yi cikin nata ta ki tsayawa. Ta zo bakin gate din a guje kenan shine wancan din ya tura ta faɗi da baya. Faɗuwar na ta yi da baya kuma akwai da ya janyo ta baya.
Damaturu, the Yobe state capital, was under heavy attack by suspected Boko Haram insurgents early yesterday morning. There were reports of intense fighting around the town, with residents fleeing to nearby bushes. An update from NTA Damaturu indicates that the Nigerian security forces have effectively repelled the attacks and taken control of Damaturu. This followed an over 9-hour battle with the insurgents in many areas of the town. However, sporadic gunfire continues up to evening hour in some areas. An uneasy calm now rests on Damaturu as residents remain indoors, while many who escaped the attack are already returning home. There is no official statement on the curfew, and as all electronic media organizations in the town are off air. The Nigerian Immigration Service is re-strategizing to intensify surveillance on the nation's border to stamp out illegal immigration in effort to counter the scourge of terrorism in Nigeria. Controller General of the service, David Parandang, stated this at the opening ceremony of the 4-day workshop for senior management of the service in Abuja. Aliyu Kabir reports.
The increasing attacks by insurgents in the country remain the huge challenge faced by Nigeria as a nation and a threat to lives and property of citizenry. Addressing this challenge is the major concern of the authorities. This is what prompted the Nigeria Immigration Service to embark on the training capacity of the senior management team comprising DCGs and ACGs from across their command in the country. The idea, the Comptroller General of the Nigeria Immigration Service, David Paradang, said, is to equip the personnel with the modern trend in the fight against terrorism and insurgency.
We know that terrorism can never remain in one country. It's an international issue. So we must, as a region, sub-region, work together. And everybody knows that if it is Nigeria today, don't go to sleep and think that it will not come to you. It might be you next. So we are working together as all. We are in very close cooperation with all of them, working together, and we will continue to do so till we bring an end to this scourge.
The CG also says that collaboration is also being maintained with relevant stakeholders to ensure that fight against Ebola is sustained in the country to remain Ebola-free nation. In Abuja, Aliu Kabir, NTA News.
Over 60 of the inmates of the Ado-Ekiti prisons who escaped following an attack by some suspected gunmen in the state capital have been rearrested. The Ekiti State Governor, Ayo Fayose, visited the prisons, and the State Controller of Prisons, Mr. Kehinde Fadikwe, had earlier disclosed efforts to apprehend the fleeing inmates. Ayo Ogunleye reports.
The Ado-Ekiti prisons, with capacity to accommodate about 200 inmates, according to eyewitness, was bombarded with series of explosions, which was said to have been perpetrated by gunmen who allegedly came to set some inmates free. With about 700 inmates and over 300 awaiting trial, the attack led to scores of inmates fleeing, while the State Controller of Prisons, Mr. Kehinde Fadikwe, said armed warders and other security agencies have commenced search to rearrest them.
We were attacked from outside, not from within, from outside. They came massively with different weapons.
The State Controller, who ruled out the insinuation that insurgents carried out the attack, promised to release official figures and facts as soon as investigation is completed.
We don't have any Boko Haram inmates here. You understand? So the motive of those that came will come to light later.
Meanwhile, security have been beefed up in the area, while visitors are not allowed except for strictly official reasons. In Ado-Ekiti, I am Ayo Ogunleye, NTA News.
As the world marks World AIDS Day, stigmatization is for those living with HIV and AIDS is still a problem. Jane Ojukwu in this report spoke with some persons living with the virus and non-governmental organizations that are of service to those affected.
In spite of the high level of awareness and accessibility to treatment, the disturbing reality is that the level of transmission of HIV has only reduced by just a fraction. Statistics show that more than 35 million people have died from the disease, while 34 million others are living with the virus. Stigma and discrimination have continued to pose a serious challenge for people living with the virus, discouraging others from seeking to know their status or getting counseling and treatment.
The major killer is stigma, and I keep telling people that we need to learn, we need to be informed. You know, it's not just somebody telling us A, B, C, D, or here, there.
Once they know that you have HIV, people run away from you. And what do they expect from that? Death.
What is the government and relevant agencies doing to make life more meaningful for people living with HIV?
If I can take you back to memory lane, the Lagos State government was the first to establish an instrumentality to begin to address the HIV/AIDS scourge. And one of the things you look at when you're addressing HIV/AIDS is, one, informing the people, and two, preventing people from getting HIV/AIDS, and three, making sure that those that do get positive have treatment available.
1 month ago, we launched the prevention of mother-to-child transmission of HIV. It is foolproof. They are available in our general hospitals, our health centers, the flagship PHCs. They are available.
Every trained medical doctor should be capacitated to attend to HIV. That's all. If we do that, we'll have a wider critical pool to give better quality response to HIV.
Now you know that an AIDS-free generation is achievable. It starts with you getting tested, knowing your status, and also getting treatment if you test positive. In Lagos, Jane Ojukwu.
Thank you, Jane, for that report. And in the studio to discuss more about the World AIDS Day, I have with me the Chief Research Fellow, Nigerian Institute of Medical Research, Yaba, Mr. Dan Onwujekwe. Welcome to the studios.
Thank you very much.
Now, globally and in Nigeria specifically, what is the state of the AIDS, HIV/AIDS?
Yes, it is known that about 34 million people all over the world are living with HIV/AIDS. In Nigeria, there are at least 3.4 million people who are living with HIV/AIDS out of these 34 million. So we are contributing about 10% of the global population of people with HIV. But in terms of AIDS-related deaths, Nigeria contributes a major quota, about 14%. So we still have a large number of these people who are living with HIV, who are not on treatment. And the issue is this stigma and discrimination. A lot of people are in denial because they don't want to be associated with being HIV positive, either at their place of work, where they live, or whatever. So that is the situation now. But we have so much experience and the technologies are available to actually get to zero transmission of HIV/AIDS and zero deaths. We at the Nigerian Institute of Medical Research in Yaba are contributing our own quota.
Yeah, but what will you say are the gains that we've recorded?
Good. We have very good access to treatment of people with HIV/AIDS and to monitoring all over the country. People with HIV/AIDS are living normal lives, are living healthy lives, and are able to work as healthy individuals. At times I teach many of them, I say, you are even healthier than people who are not HIV positive. So why do you have to worry about it? You have to take your health and your life into your hands because you have seen what has been achieved. We have had a lot of gains. People in the Nigerian Institute of Medical Research, we've been running an HIV/AIDS treatment clinic for the past 12 years. And we have about 20,000 to 26,000 people who have registered. About 15,000 of them are accessing treatment, and they are doing very well. And this achievement is also replicated in so many parts of the country.
But even as we talk about our achievements, what would you consider as challenges that we have?
The major challenge we have is stigma. Stigma and discrimination is making many people not to come out. We have only about 400,000 people who are accessing treatment, but we know that about 1.4 million Nigerians or 1.5 million Nigerians are eligible for treatment. Where are the rest of them? There's a 1 million gap. So the aim of the World AIDS Day will be, let us close these gaps. There are so many gaps in access to treatment. The treatment is available there, but people are not coming out as you would expect them.
But would you say the level of sensitization so far has not even reduced the level of stigmatization?
Yeah, the sensitization is going on. It needs to be intensified and extended to all communities, not just the urban areas. I am not sure that we have the same level of awareness in rural communities. So we need to, what we should achieve with the World AIDS Day is to take the knowledge we have, spread it all around. We shouldn't relax and use the knowledge we have to move forward in making sure that AIDS and HIV is brought under control.
Let's look at mother and child transmission, the level of safety in that aspect.
Yes.
How is it in the country?
Prevention of mother-to-child transmission works. And like has been said by somebody from Lagos State, facilities all over Lagos are available where people are capable of delivering the prevention of mother-to-child transmission services. It works. A mother...
We are given a scenario in Lagos.
Yeah, the same scenario is available all over the country. Every health facility, not just doctors, every primary health care center can have workers who are capable of preventing mother-to-child transmission. Every level of healthcare delivery has its own contribution to make. The technology is not difficult, and everybody can offer some services to prevent mother-to-child transmission. And there is collaboration with the bigger centers like NIMA and all the teaching hospitals and all the general hospitals, where people can be monitored using viral load, CD4 count measurements, and others to make sure that by the time they deliver, the risk of transmitting to the child is drastically reduced. And we're achieving this. But what we're saying is that we need to use our achievement we need to boost it. We shouldn't relax and say this is available. We need to take it. There is a gap somewhere. I think that a lot of pregnant women are still going to traditional birth attendants. That may be where the gap in prevention of mother-to-child transmission has to be followed up and breached. We need to take these services.
But are there key preventive measures they can take?
Yes. A mother who is HIV positive can transmit to the baby while she's still pregnant, as well as during labor and during the period of breastfeeding. Measures have to be taken to ensure that the risk of transmission is reduced at these 3 stages if we have to achieve an AIDS-free generation. And the knowledge is known. the measure they can take is that they should adhere to what they are being given at the PMTCT centers. A mother in that situation needs to take antiretroviral drugs to suppress the viral load, bring it down to the level where the risk is almost zero, so that it doesn't transmit to the child at any of these stages. And such a mother is not, there are guidelines for delivering such mothers, which any accoucheur, any midwife or doctor or obstetrician can implement. So these things can be done, and children, the future generation we can be sure that the future generation will be free from HIV/AIDS. These are doable.
I know in the past it was really big deal for you to do HIV test. In fact, you can go for your blood sample, and when you want to collect your result, you have to be peeping to be sure people around will not know your status and stigmatize you. So do we have a lot of people walking into centers and freely doing HIV tests today?
Oh yes. Prevention of, HIV counseling and testing centers are available in all health facilities. And people can walk in and do the test. But like I said, the stigma is still there. A lot of people will avoid such places because they don't want to be seen. But opportunities are being provided. Every community can be, guided to a nearby health center, and we try to make these things really voluntary. You don't give the person his results in public. You don't announce it. People should be trained so that they will respond well to these health workers. To these patients who come forward. Let me give you an example. I took HIV counseling and testing to my town meeting on Saturday. We had a convention, and I thought that this would be an opportunity to give people the opportunity to be tested for HIV. And lots of them walked up to be tested freely. So people are aware and they are accessing if it's available. But we need to do a lot more to ensure that we use every available opportunity, because HIV is still with us. The message of the World AIDS Day is that although we know what to do to get to a zero infection and death, but we need to still work hard to ensure that we are not resting on our oars.
But how easy is it to live with HIV, to manage HIV?
I think it's very easy. I think it is very easy. Any health worker can learn how to manage HIV. Any health worker.
You're talking about health work. I'm talking about those living with HIV. If you go and you test positive, how is this something you can manage on your own?
Exactly. It's not that they can manage. Managing on your own doesn't mean the person should go in and take treatment. A health worker has to decide when the person is eligible for treatment. A health worker has to guide you with the quantum of knowledge that is already available to empower you as a health worker to live positively with the HIV, with the virus, to adhere to treatment. Treatment of HIV is not a respecter of persons. It is not something you will take when you remember. So a health worker needs to guide the person living with HIV. And the person will also be able to guide others in the community. Health workers cannot do it all alone. So people living with HIV are part of the forces that are needed to participate in coming to this achievement.
Do you have a last word for viewers, like a counsel to the public?
Yes, viewers. Yesterday was World AIDS Day, and we used the opportunity to remind everybody that HIV/AIDS is still here with us. Nigeria is one of the major countries affected by HIV/AIDS. The treatment for HIV/AIDS is available, and it is virtually free of charge compared to what it costs. A lot is being done to help people with HIV. My message to every Nigerian is, please stop discrimination against people with HIV, because they are useful citizens, they are healthy, and they don't put you at any risk.
Thank you, Dr. Dan Ojekwe, Chief Research Fellow, Nigerian Institute of Medical Research. Yaba, thank you for coming to the program.
It's a pleasure.
And you've heard him, HIV is not a death sentence.
It is not a death.
We'll take a break, and when we return, we'll talk more.
There is an Ebola virus epidemic in some West African countries. The Nigerian government wants you to be aware and watch out against the spread of Ebola in your community. Help keep our country safe. Refer anybody coming into Nigeria from any other West African country to a hospital for proper medical screening. And watch out for severe cases of fever, headaches, diarrhea, chest and abdominal pain, sore throat, cough, red eyes, and bleeding from the eyes, ears, and nose. Protect yourself. Wash your hands regularly with soap and sanitizer. Avoid contact with the blood, urine, feces, or saliva of animals like bats, monkeys, gorillas, chimpanzees, or infected persons. The Ebola virus is deadly. Don't catch it. Don't spread it. This message is brought to you by the Federal Ministry of Information.
This is still Panorama, and now to news making the rounds in the entertainment world.
It was a night of reminiscences at the Africa Meets Reggae concert that held at the hockey pitch of the National Stadium over the weekend. The concert attracted reggae lovers and artists from within and outside the country. The concert, according to the organizers, is designed to rekindle the reggae spirit among Africans.
I'm having fun. I like the fun based on I have enough space to dance.
They need to express themselves. We have music. It is both an art, an expression, and a business.
A 24-hour curfew has been imposed in Damaturu, the Yobe state capital. A statement issued by the special advisor to the governor on media, Abdullahi Bego, says the curfew affects the only state capital, Damaturu. The curfew, which takes off immediately, was approved by the governor, Ibrahim Gaidam, after consulting with the heads of security agencies in the state. And on that note, we wrap up Panorama today from the Lagos Network Center. Thank you for watching.